Hello, my name is Karen Motley. I'm part of the Health Information Management Department at Sinclair Memorial Hospital. I'll be your tour guide today as we venture through the HIM department. Before we get started, let's begin with a little background about the hospital. We're part of a 6-hospital network that also has other medical offices and clinics. Sinclair Memorial Hospital is an acute care facility with 305 beds. Some statistics you may be interested in knowing is that Sinclair Memorial Hospital has an average of 6,300 inpatient visits per year. Our emergency department sees 17,000 patients per year. We have 13,600 clinic visits and 8,500 outpatient visits. And in case you're not familiar with the term ambulatory visits, let me explain. Ambulatory visits occur when a patient comes to the hospital, has an outpatient surgery such as a laparoscopic cholecystectomy or appendectomy, and then goes home after a short recovery period. We also have 25,000 diagnostic encounters. Diagnostic encounters occur when patients come to the hospital for testing, such as an X-ray or blood test. I thought you also might be interested in knowing some of the services provided at our facility. We provide community health, primary care, home health, heart care, cancer care, and many other services. As we get ready to enter the HIM department, let me remind you of a few things. First, let's talk about dress code. I know there are HIM departments in other hospitals that have a different dress code than ours. Some HIM departments allow their employees to wear scrubs. However, the dress code for our department is business casual. We maintain this dress code so that our department projects a professional image. You may notice that I'm wearing an ID badge. As a hospital employee, I'm required to wear my ID badge at all times, and it must be located above my belt and always visible. This badge allows others to know that I'm an employee of the facility, and it also contains the electronic permissions that grant me entrance into restricted areas. In most facilities, the HIM department is located in an area of the hospital that is accessible to the public but is away from patient care areas. Inside this area, there's a window which allows customers to be greeted by an HIM employee but not permitting access into the department without permission. This is by design. The HIM department must be secured to keep the public and other unauthorized hospital employees from entering. In order to enter the department, I must have the appropriate permissions, and these permissions are coded into my name badge. Let's enter the department and take a look around. Let's take a moment and talk about how a record gets started. Let's start with a typical patient brought to the emergency room by an ambulance. The patient is triaged by a nurse, and the nurse starts an electronic record for this patient by documenting health data. As this patient continues to be seen by other healthcare providers, all healthcare information is recorded in the electronic healthcare record, or EHR. Physicians, such as the ER physician and the radiologist, may dictate their reports into a voice recognition system, which produces a transcribed ER report and radiology report. But now, with the widespread use of the EHR, there's often no need for dictation and transcription because the computer system builds the report based on data entered by the care team. Remember, you'll see variance in the use of technology from organization to organization, and the use of dictation and transcription is one of those variances. Now keep in mind, if the patient had already received services at our hospital or within our healthcare network, the patient has already been assigned a unique medical record number, a number that will be forever assigned to this patient. Any and every time he or she receives care within this network, she will have that number. In addition to the medical record number, for each encounter, the patient receives an account number. Each time the patient receives care, he receives a different account number. The account number is different for every encounter. Think about it. The patient has 2 different numbers: the medical record number, which always stays the same for that patient, and the patient also receives an account number, which is different for each and every hospital encounter. The account number is generally used to group charges and activities for one single encounter. So, going back to our ER patient, Let's pretend the patient's condition requires him to be admitted to the hospital. He stays 4 days and is then discharged. Throughout his stay, healthcare providers have been documenting progress notes, treatment care, medications, and so on, all in the EHR. There are some documents, however, that may not have been able to be created or reports that did not interface into the EHR. For example, a patient signed informed consent, perhaps telemetry strips, or the patient's ambulance run sheets may still have been created on paper. With the electronic age, there are not too many of these paper documents anymore, but there still are a few. Each day, an HIM professional goes to the various nursing units and collects any paper documents for discharged patients. These documents are brought to the HIM department to be scanned so that the entire record is available electronically. And while there are some hospitals and large clinics that still use paper records, these are few and far between due to government initiatives encouraging the use of EHRs. It's still fairly common today to find some paper records in physicians' offices, but over time, these too will likely transfer to EHR format. Let's take a few minutes to meet Ruth. She's responsible for scanning documents that couldn't be electronically entered into the EHR. Hi, Ruth.
Hi, Karen.
Could you tell us how you get the documents to scan?
Sure, Karen. My job starts with going to all of the nursing units to collect any documents that are not in our electronic health record.
I understand the entire scanning process has different steps. Can you show us the first step?
Sure. The first step is called prepping. Prepping is important to make sure that the document is not torn or tattered and has no staples. In general, that it will make it through the scanner. Oh, I hate it when I get a paper jam in the scanner. I have to look at each document and make sure there are 2 different patient identifiers, such as the patient's name, medical record number, account number, or date of birth on the document. If not, it's my responsibility to research the patient's name and write the patient identifiers on each document. This step makes sure the document reflects the correct patient and the appropriate encounter for that patient.
Sounds like we consider staples and tears as job hazards. So what is the second step in the scanning process?
Scanning comes next. This is the easy part. I put the prepped documents on the paper feed of the scanner. If I've prepped correctly, the documents zip through the scanner, which captures an image of the document. I'm almost done with this batch. Let's see how it goes. All went through without a hitch. The final step in the scanning process is indexing and quality assurance. This is the step where I must look at each and every document online, and for every single document, I have to validate that the document is matching up with the correct patient encounter. Some people may not find my job interesting, but I enjoy it.
Oh, I can definitely appreciate the importance of scanning documents and making sure the patient's health information is available on the EHR.
Absolutely. And after I've confirmed the record was scanned appropriately, the records are staged for destruction. We use a vendor that certifies appropriate destruction using giant shredders or in some cases by incineration.
Ah, for confidentiality purposes, we definitely have to use the appropriate destruction. Now, throwing them away in the trash can is obviously not acceptable. Thanks, Ruth. We appreciate your explaining your position to us. As we continue to follow the flow of the record through the HIM department, the next step includes an HIM professional performing the analysis process. This process includes assuring that all reports are completed and signed. Let's go to the area in the department that performs analysis. Let me introduce you to Gloria. She's an HIM tech responsible for record analysis. Hi, Gloria.
Hi, Karen.
I've often heard your job compared to a scavenger hunt. Is that how you describe it?
Yes, Karen, my job is like a scavenger hunt. It's my responsibility to make sure the documentation requirements on the medical record are present and accounted for. And this process used to be so much more labor-intensive when it was a paper-based system.
I'm curious. I thought with an EHR there wouldn't be any more record deficiencies.
No, it's not that there are no deficiencies with an EHR. Now there are just fewer deficiencies. So with an EHR, physician orders and progress notes are electronically entered, so there's no analysis required to assure the entries are dated, timed, and signed. This occurs automatically as the entries are made. So having all medical record entries dated, timed, and signed is important since this rule comes from the CMS's conditions of participation. Remember, the conditions of participation are federal rules that all hospitals must follow.
Are there still some record deficiencies that you have to identify?
Oh, absolutely. Like checking for a history and physical, a discharge summary, and an operative report.
So, can you tell us how you look for these deficiencies?
A very important function of my job is to review each patient's medical record after discharge, identify any deficiencies, and then electronically flag them in that encounter. I have to enter a deficiency code into the EHR and then electronically attach that deficiency to the appropriate physician responsible for completing the deficiency. And this is the beginning step to alerting physicians of missing or unsigned documentation. I truly enjoy my job, and like you said, it is a bit of a scavenger hunt.
Thanks, Gloria. Sounds like your job's extremely important to make sure health records are accurately completed.
You're welcome, Karen.
As we continue to follow our record processes, our next stop is the coding area. As you're probably already aware, HIM professionals are responsible to assign code numbers to the diagnosis and procedures that occur during a patient's stay. Let's meet Carl. He's a coder in the HIM department. Hi, Carl. Can you tell us a little bit about yourself?
Hi, Karen. Of course, I'd love to. I've been a coder at St. Clair Memorial Hospital for over 15 years now. I earned an RHIT and have coded ever since I received my credentials. I started as a coder for outpatient accounts, which tend to be a lot easier, less complicated type of accounts. As I gained more coding experience, I then moved over and started coding ambulatory accounts. And now that I'm a really experienced coder, I code harder, complex inpatient accounts.
Sounds like you've had quite a bit of coding experience. I'm curious. I know that there are many other coders that work for this hospital, but I don't see any other coders here today.
That's true, Karen. I'm in the office today, but I usually work from home. When I first started my job, I had to complete all my training right here on site. And during my training time, someone checked my accounts 100% of the time to make sure everything was correct. It took me about 6 months, but once I met quality and quantity standards, I was able to start working from home.
I know there are a lot of people that wish they could work from home.
I love working from home. However, it took me a while to get used to it. I had been very used to being around other people every day, now only chat online with my coworkers during online meetings and other trainings.
Did you have to buy your own computer?
No, the hospital supplied all of my equipment for me to work at home. And because they own the computer, I really can't use it to do any personal business, can't check emails, can't surf the web. I can only use it for hospital business.
Oh, that makes sense. I was wondering, since you work from home, do you have any flexibility with your schedule? What hours do you work?
You know, Karen, I get asked that question all the time. Each day I log on and must clock in using the hospital's time and attendance system. We have flex hours. The accounts that I'm responsible for coding are routed through me through my work queue. And I have to meet quality and quality standards, or I have to come back to work at the office and coding. Working at home actually takes a lot of self-discipline. You know, it's very tempting to throw a load of laundry into the washer, or to, you can see the dishes and you really want to do this, but you have to let it go. You have to treat your time at home exactly like you would treat your time at work.
Isn't it great not to have to drive into work every day?
Oh yes, I absolutely love the fact that I don't have to drive to work. However, I have a friend who codes for another hospital system, and even though she would like to work from home, she has to go to a business office, which is really close to the hospital.
Yes, not all coders get the opportunity to work from home. So, Carl, do you like your job as a coder?
I truly enjoy coding. I enjoy reading the medical information, deciphering the information, and funneling it into codes. I know a lot of the hospital revenues is a direct result of my coding accuracy. It puts a lot of pressure on you, but I really like the challenge.
Thanks, Carl. I know a lot of HIM credentialed professionals code or have jobs that are related to coding. You stated that your credentials are RHIT, correct?
Yes, I am an RHIT, but there are others that work with my organization that have a CCS in our healthcare network. The coding manager is actually an RHIA.
I know it takes a lot of practice to get really good at coding. Thanks, Carl, for sharing with us. Let's continue to follow the flow of medical information. If you remember, we previously analyzed the record and indicated any physician documentation deficiencies. Did you wonder what happens with the deficiencies that were entered? There is an HIM professional who is responsible for monitoring this completion process and making sure physicians are held accountable for completing all deficiencies. I'd like now to show you the physician incomplete record area. It's a continuation of that deficiency process. Hi, Julie. You work with physicians in this area. Can you tell us about your job responsibilities?
Sure, Karen. My job as an HIM tech includes working with the physicians to assure that all medical record deficiencies are complete and completed in a timely manner. Our hospital is accredited by Joint Commission, and we have to follow their rule that all records must be completed within 30 days after treatment.
Now that most hospitals use an EHR, can physicians complete their deficiencies without having to come into this area?
Yes, although physicians can complete their records online, sometimes they still like to come to this area to do their charts. I think it's just a habit, or maybe it's just because we have good snacks here for them to eat. Due to electronic signatures, most record completion is completed online. However, when necessary, I work with the physicians to assist them in any way I can with record completion.
Can you tell us how this occurs?
Well, I monitor the completion of all their record deficiencies. As deficiencies are completed online by physicians, the system deletes the record deficiency entry. However, there is a need for someone to monitor the system, make manual edits, track the deficiencies, and so on. Let me give you an example of making a manual edit. Let's say a physician is assigned to complete a discharge summary. However, during the patient's stay, the physician turned the patient over to a surgeon. It's my job to make sure the deficiency for the discharge summary is changed to the responsibility of the correct physician.
I see. Earlier when you said monitor the system, what does that mean?
It means that I'm responsible to verify the deficiencies, and I send physicians weekly notices of their deficient records. If the physician doesn't complete his or her records in a timely manner, and the record becomes delinquent, which means the record met the 30-day threshold for the number of days it has been incomplete since discharged, I am responsible to send let's just call it a nastygram notice, alerting the physician that his or her admitting and surgery privileges at the hospital will be suspended.
Oh, and I'm sure physicians love those notifications.
Well, let's just say they're not usually real happy about it, but however, these notifications usually get the physicians to complete their record deficiency. If the physician doesn't complete his or her delinquent records, I alert the chief of staff, the admitting department, and the surgery that the physician privileges are suspended. This step definitely gets the physician's attention, and the physician completes all of his or her delinquent records. It's important to monitor this entire process to assure that our hospital stays in compliance with record completion standards.
Thanks, Julie. We appreciate you sharing your job and the incomplete record area with us.
Well, thanks, Karen. I'm glad I can help you.
Once records are completed, they must be maintained for a certain amount of time. The rules and regulations that dictate this length of time are state and federal regulations. If these sources don't have a requirement, the rule of thumb is that HIPAA mandates that records are kept a minimum of 6 years. And in the case of children under the age of 18, these records must be kept until the patient turns 21 years old, plus 6 years. It's important to realize that HIM professionals are responsible for the release of protected health information, or PHI. The team that's responsible for this works in the release of information area. In our hospital, the ROI team is responsible for releasing all medical information. Let's see how it works. Can you tell us about your job, Sheena?
Sure, Karen. We're open during regular business hours, 8 a.m. to 4:30 p.m. We continuously receive phone calls, mail from patients, healthcare providers, attorneys, insurance companies, and other agencies that need information from health records. It's our responsibility to validate the request, make sure the release is authorized by the patient.
Can you give us a brief walkthrough of the steps you take to assure the medical information you release is authorized?
Our first step is to assure that the patient has actually received services at our hospital. We go into our ROI module of our electronic health record to locate the patient's name. If the patient has received services from our facility, we then turn our attention to the request and authorization. We must validate the request, making sure our hospital's name is on the request, assuring the dates of service are indicated, and making sure the date of the patient's signature is within the defined time limits for a valid authorization. Then, depending on the requester, we have 3 options to get the information ready: print the documents, auto-fax the documents, or create a CD for the requester.
So, if everything checks out A-OK, how do you get the information ready for the requester?
Our systems contain defined subsets in which we can put checks and the medical documents are replicated. We must document who the PHI is being released to and when.
This seems like a lot of tracking.
You're right about that, but it's mandatory. The accounting process is required by HIPAA. We do charge some requesters for the duplication, but we do not charge for continuity of care issues, such as releasing medical information to another healthcare provider needing copies to continue care for the patient. We follow state guidelines for charging. HIPAA also mandates that we respond to requests within 30 days. We have to continually make sure we're releasing only authorized information and that we're doing it in a timely manner.
It sounds like in your ROI tech position, you work a lot with the public.
I sure do. Customer service is vital to this position, and as this is one of the very few HIM positions that deal with the public. And I have to admit, some people are not very nice. When I have to tell them the information they're requesting cannot be released without a valid authorization.
And I'm sure that news makes some people really happy.
Whew, sometimes people can be really, really rude. When I have to tell them that they don't have the right to someone's medical information, but I also know that I can personally be held legally responsible for a breach, which is the release of unauthorized PHI, I definitely don't want that to happen.
Absolutely. I'm curious, what happens if records are required for court?
It's my responsibility for preparing records to go to court. It's important to remember that a subpoena is not good enough for release of medical records. Before I can release records to a court, I'm responsible to make sure a court order is signed by the judge, or a patient can sign an authorization. Many times, if an authorization's been signed by the patient, I can send the records to the attorneys instead of going to court. But there are a few occasions where I have to prepare paper copies or other media for court. Phew, but I'm so glad my supervisor is the one who actually has to take the copies to court and get on the stand to swear that the evidence is a true and accurate copy.
Sounds like you don't want to be the one on the stand getting questioned by those attorneys.
Absolutely not. I really enjoy my job here in ROI. It's never the same thing, and I enjoy the challenge of being a good gatekeeper, making sure I don't release information that shouldn't be released.
Hey Sheena, I'm curious. You talked about your EHR. Do you still actually have any paper records here at the hospital?
Yes, we still have some paper records because of the retention laws, which mandate that we are not allowed to destroy them yet. These paper records, however, are currently kept off-site, and as soon as these records meet the mandated time limit, they too will be destroyed.
Technology with the EHR now enables patients to access their own medical information through a patient portal, correct?
Yes, we still maintain the legal patient record, but general access to their own information is getting much easier for patients. Over time, we suspect this will reduce some of our workload, and that's not a bad thing, because we're pretty darn busy.
Thanks, Sheena. Yes, indeed. You obviously have a very important role in patient privacy and confidentiality. I appreciate you sharing with us.
Thanks, Karen. Anytime.
Now let's visit our RAC coordinator. Jill.
Hi, Karen.
Can you tell us what a RAC coordinator is?
Sure, Karen. The acronym RAC stands for Recovery Audit Contractor. The RAC program, which is mandated by Centers for Medicare and Medicaid Services, or CMS, detects improper payments for healthcare services. There are subcontracting agencies throughout the United States that serve as RAC agencies. The RAC agency is responsible for identifying overpayments and underpayments for services provided to Medicare patients.
I see. What is your role in the RAC process?
I serve as the focal point of all RAC activity for our hospital. All facilities receive RAC audit lists, and it's my responsibility to coordinate the review and responses for the information requested.
I bet there are a lot of rules you have to be aware of.
You got that right. Timely and accurate responses to these requests are paramount, since a late or inaccurate response will result in the denial for payment of those hospital services. I analyze all RAC findings and am responsible to challenge any possible denials for payment. It's also my job to develop training programs for our physicians, other healthcare providers in the hospital, and coders, because it is extremely important that I share the finding of my clinical review to ensure that we are correctly identifying any issues. My ultimate goal is to implement actions that will assure that our facility bills for and receives proper payment from Medicare healthcare services. I enjoy my job, and I realize there's a lot of money riding on my skills and coordinating efforts.
Thanks, Jill. You obviously have a very strategically important position, especially when it comes to challenging denials. I appreciate your time today.
No problem.
Next, let's meet Beth, who is the HIM Department Director. Hi, Beth.
Hi, Karen.
I know you're swamped with work, but can you tell us a little bit about yourself?
Sure, Karen. First, you probably need to know that I have a bachelor's degree in health information management. I also have the RHIA credentials, and I've worked in HIM for over 10 years.
Wonderful. Can you tell us a little bit about your job duties?
Well, I'm responsible for the overall function of health information management. This includes budgeting, monitoring, planning, and directing. I'm also responsible for the ongoing quality and efficiency for all areas and processes in the department. I have to keep current with the requirements of regulatory bodies. I'm responsible for strategic planning and process improvement.
Can you tell us a little bit about the staffing of the HIM department?
Absolutely. We operate 2 shifts each day, 6 a.m. to midnight. We have 1 site manager and a supervisor. We have 24 employees who work on site in our HIM department in the areas that you visited, except coding. Coding is centralized for our entire network, so we have a lot of coders in our network. And most of our coders work from home, which they love. We have 34 inpatient coders, 33 diagnostic and ER coders, and we have 22 OPS and observation coders.
Wow, you have a large department and lots of coders. Beth, as a director, I bet you use a lot of communication and leadership skills.
Yes, as the HIM director, I have to assure that I share my vision with my staff and provide the necessary effective leadership to maintain an effective and efficient department. I must also build and maintain strong relationships with other key leaders in our hospital and with our physicians.
I bet it's a challenge to keep up with all of the changes occurring in the HIM field.
Yes, I have to stay abreast of all the new technology and strategies in HIM. And I encourage my staff in HIM to be life learners. The world of our HIM continually changes, and our skill set must continue to evolve as those changes occur.
Sounds exciting, and I can tell you enjoy your job.
I really do. It definitely has its good days and its challenging days. But I think that's true for any job.
Thanks, Beth. You definitely have a lot of responsibility, and a lot of people are relying on your direction and supervisory skills. Thanks for taking time out of your busy day to share with us. Let's take a minute to go into one of the computer labs and meet the person responsible for introducing the hospital's EHR to the HIM employees. Hi, Amin.
Hi, Karen.
Wow, you are really surrounded by computers in here.
Yes, Karen. I spend most of my days teaching new HIM employees how to sign into the EHR and how to maneuver through the software.
So you must be an EHR expert.
Well, I'm not sure about that. However, it's my responsibility to be familiar with all of the HIM modules in our EHR. We have what you call a practice area, or some call it a playground, where I can work with new employees and show them the various modules so that they can get comfortable using the EHR with no fear of hurting anything.
I like the idea of a safe practice area.
So do our new employees. In addition to a practice environment, there is also a test environment. It's a copy of the real system. This is where the core IT support group loads and tests new releases of the EHR. Since this environment is a copy of the real system, it's good for working through any possible problems before the new version is loaded into the live system.
I can definitely understand why you want to test a new version in a test environment before loading it into the real system. Very strategic. Thanks, Amin, for giving us a little insight into your job.
Thank you, Karen.
Now let's take a look at some other HIM professionals who perform HIM-related functions, both in and out of the HIM department. Let's first go to the transcription coordination area. Hey, Lisa.
Oh, hey, Karen.
Can you tell us what happens in your part of the department?
Oh, sure. First, let me give you a brief definition of transcription. Transcription is where the spoken word is translated either by voice recognition or word processed into the written word. In this area, we're responsible for monitoring the voice recognition process, for editing reports that were incorrectly translated. Some facilities outsource their transcription. We use a voice recognition capability that's right within our own EHR.
Can you tell us a little bit about the responsibilities of an editor?
Oh, sure. For example, let me think of one. Oh, let's say the physician may have said the patient was circumcised. However, in the report, it was incorrectly recorded as circus-sized. So it's our responsibility to correct those errors to assure accurate medical records are on the patient records. And it's also our responsibility to assure medical reports are connected to the appropriate patient encounter. Let's say a report like a history and physical or an op report, if it doesn't exactly match the patient's encounter, these are the reports that we investigate and match them. Sometimes it's like solving a puzzle to determine the appropriate encounter, but we love it.
That's great. Thanks, Lisa. Sounds like your responsibilities are vital to assuring the right report ends up on the right record. Thanks for taking time to share this information with us.
Oh, you're welcome.
Okay, gang, the cancer registry's next. Hi, Whitney. Can you tell us about the cancer registry?
Sure, Karen. The Cancer Registry is responsible for the collection, management, and analysis of data on individuals with a diagnosis of malignant or certain benign neoplasms. Cancer Registry is responsible for determining that all data collected is accurate, timely, and useful.
What type of information do you collect?
Data collected includes but is not limited to demographics, diagnostics, treatment, and outcomes of information.
What happens with this data you collect?
The data is then submitted to the State Central Registry and the National Cancer Database. Cancer Registry data is used by the public health officials to determine if optimal care is being provided to patients with a reportable diagnosis. It's also used to assess patterns of referral, improve patient outcomes, determine the need for professional and public educational programs, and also how to best allocate resources.
How do hospitals use this data?
Hospitals use the data I collect to meet regulatory and accreditation requirements, analyze diagnosis, treatment, and follow-up. The data also provides information about the facility's cancer program, clinical trials, and is used to develop educational programs for patient health care professionals and the general public. I work closely with the pathologists in our organization and the hospital-wide cancer committee that's composed of many clinicians like nurses and therapists.
Very interesting. Now, are you officially part of the HIM department?
No, in our facility, Cancer Registry is not located in Health Information Management, or actually even considered part of the HIM department. The registry is considered its own department, and we report to Oncology Services.
If students are interested in becoming a registrar, what do they need to know?
It's very important that they understand anatomy, physiology, disease processes, medical terminology, and of course be very familiar with computer applications. Facilities require a cancer registrar who abstracts to have CTR credentials, making them a certified tumor registrar. And to be a CTR, this requires additional education on top of your 2-year degree, plus passing a national exam. My job as a tumor registrar provides variety, flexibility, and opportunity while always learning.
Thanks, Whitney. It's always interesting to hear the different career paths that HIM professionals have chosen.
You're welcome.
I'd like to now introduce you to an HIM professional that works with our Healthcare Network's Master Patient Index. Hello, Diane. You have a very unique position. Can you tell us a little bit about your job?
Certainly. As we all know, it's important that patient medical information all stays together. What I mean by that is each time a patient has an encounter with one of our facilities, like a clinic visit, hospitalization, outpatient lab test, anything, it's important that the exact same medical record number is used and that the medical information is always maintained under that same number.
I can definitely see that happening. For example, when a patient presents at a registration point, the clerk accidentally selecting Ronald Jones Jr. instead of Ronald Jones Sr.
Exactly. In that case, when the care provider goes into the AHR to review the medical information for Mr. Jones Sr., it can't be found because it's now under Junior's number.
Oh, and let me guess, that's where you come in.
Yes, it's my job to research and make sure when this type of situation happens, information is electronically directed to the correct number. Also, when a patient has two different medical record numbers, I must merge these accounts to make sure all the information is directed to only one number.
Sounds like you are quite the investigator.
Yes, it's important to make sure medical information lands in the appropriate account. It has to. Otherwise, medical decisions could be made using incorrect data, and that's definitely not good.
Totally understand. Diane, keep up the good work, and thanks for telling us about your job.
You're welcome, Karen. Anytime.
Next, let's go meet the hospital's privacy officer. She works in the administrative office area of the hospital network. Hi, Juanita.
Hi, Karen. How are you?
Doing well.
Good.
Can you tell us a little bit about your job and your position here?
Sure. I have RHIA credentials, and I am the privacy officer for our network. It is my responsibility to oversee all activities related to our network's health information access in compliance with federal and state laws for our information privacy practices. I'm the leader of the Privacy Oversight Committee. I provide training and education for new employees, volunteers, and students to assure that they are familiar with the do's and the don'ts when it comes to privacy.
Interesting. Do you have any methods that you use to check for potential privacy breaches?
You know, I've been known to dumpster dive on occasion. That's because I walk around the facility and snoop around in recycle bins or perhaps a trash can near a copier machine. I look to see if there are documents that might have patient identifiers on them. That's a real big deal around here. Changes in technology always present new challenges for a privacy officer. Mobile devices like smartphones and tablets, as well as social media like Facebook and Twitter, have made me really rethink my approach for protecting patient privacy and safeguarding patient information. I am very serious when it comes to assuring patient information is protected and remains private.
Thanks, Juanita. It's good to know that you are at the helm and continually making sure that everyone in the facility is aware to keep private things private.
No problem, Karen, anytime.
Now let's meet the HIM professional who has the title of IS&T Application Analyst. Hi, Kayla. First, can you tell me what IS&T stands for?
Everyone asks me that. It stands for Information Systems and Technology.
And can you tell us a little bit about yourself?
Sure. I'm a credentialed HIM professional who is in the right place at the right time. My past experience with an EHR and my education in HIM helped me land this job. I'm the person who goes out into the many physician offices within our network, and I'm also responsible for implementing and supporting designated software applications. I support the physicians, the clinical staff, and the office staff. I provide training and support for their systems.
Sounds like you have to know a lot about a physician's office, how it operates, and how their EHR functions.
Yes, my background is in acute care, but my skills are transferable to a physician's office setting.
Awesome, Kayla. It's wonderful to learn how HIM professionals are working. Let's now go to the Quality Improvement Office. There's an HIM professional working in that office I'd like you to meet. Let me introduce you to Saria. She is one of our data quality managers for our hospital. Hi, Saria. Can you tell us about your job here in the QA office?
Sure, Karen. I'm responsible for developing, implementing, and maintaining data quality management, like a compliance plan, for example, for coding and reimbursement, health records, and documentation and quality data in all divisions of my organization.
Okay, can you give me an example of how you accomplish this?
Well, to put it in simple terms, I'm like a double check, making sure the documentation in the health record is adequate and the coding meets the compliance standards.
Oh, gotcha. You must have quite a bit of coding experience under your belt.
My background in coding includes both ambulatory and inpatient coding. I also have law for statistics and analytics.
Gotta love statistics. Thanks, Adia. I appreciate you sharing with us.
You're welcome.
I want to introduce you to Michelle. She's a project manager for our healthcare network. Hi, Michelle.
Hi, Karen.
Your office is located in the building for the corporate offices. Can you tell us a little bit about yourself?
Sure. I have a bachelor's degree in HIM, and I have the RHIA credentials. My responsibilities include leading a project from its inception to execution. While my office is located here in the IT department, all of the projects I'm responsible for occur outside this office.
Can you give us a few examples of the types of projects that you coordinate?
Absolutely. All of my projects are HIM related. For example, we're currently in the midst of investigating software for automated deficiency processing. Another example is coordinating the transition activities when we acquire a new facility and or take over the HIM functions of the other areas within the organization, like we just did with our home health division.
Oh, gotcha. These are very large and very diverse projects.
Yes, I was fortunate to be given the opportunity to do project work in previous positions, and that first-hand experience has been invaluable. Also, I have now completed 32 hours of project management courses and am currently preparing for my project management certification.
Wow, you are really ambitious. Why, I think you can definitely be called an overachiever. I love it. Thanks, Michelle, for sharing with us, and I wish you the best in the pursuit of your certification.
Thanks, Karen.
I'd like to show you one more HIM professional who works in our healthcare network but doesn't work in the HIM department. She has the title of Senior Data Analyst. Hi, Robin.
Hi, Karen.
Can you tell us a little bit about how your position is different than the non-traditional programs in HIM?
Yes, I work with clinical and financial data surrounding the robotic procedures that are performed within surgical suites within the network.
And tell me a little more. What do you do with this data?
Well, I look at data to discover trends and patterns in order to increase efficiency and reduce cost across our healthcare network. I work with business intelligence tools to analyze the data and do very little with the actual medical record.
So you don't work with the medical information contained in the medical record?
No, I mainly focus on data acquisitions and data visualization. Data visualization, or visualized data designs, are graphics that break down large amounts of complex data into clear, digestible chunks for the viewer. The data visualization provides numerous possibilities for creating something the viewer will actually remember.
Sounds extremely technical.
It is, but that's why I love it. I enjoy building data visualizations and teaching programs on how to interpret the data and take action on it.
I can tell analytics is right up your alley. Thanks so much for sharing with us today.
Oh, thank you, Karen.
That concludes our inside tour of the HIM department. Let's step outside and review what we've seen today. While every health information management department may not be organized exactly as our department was, the functions are very similar. As you have seen, there are many different component parts. We all work together with a common goal of providing quality service to our customers by ensuring accurate, efficient, and effective management of quality health information, along with maintenance and appropriate release of patient information. The HIM department offers many diverse and unique opportunities for the HIM professional, so as you begin your journey into the HIM world, always keep your options open and remember that HIM-related positions are ever evolving. Thanks so much for coming on this tour with us. I wish you the best in your educational endeavors, and I wish you much success in the health information management profession.